Imagine this. You're going about your day, feeling fine, when suddenly your body starts sending you strange, subtle signals, little whispers that something might be very wrong. But here's the kicker. These signs are so easy to brush off, so easy to ignore, that most people don't even realize they're standing on the edge of a life-altering diagnosis. Stomach cancer. It's sneaky, it's silent, and it's one of the deadliest cancers out there. But what if we told you that your body might already be trying to warn you? What if the clues are right in front of you, hiding in plain sight? Today, we're diving into the 8 strange signs of stomach cancer. Symptoms that might seem harmless at first, but could be your body's desperate cry for help. These aren't your typical textbook symptoms. We're talking about weird, unexpected, and often overlooked red flags that could save your life or the life of someone you love. From that nagging bloating you keep blaming on your diet to that weird taste in your mouth you can't quite explain, these signs are more than just annoying. They could be deadly serious. But here's the thing, knowledge is power. The sooner you recognize these symptoms, the better your chances of catching this disease early when it's most treatable. So, if you've ever felt a strange pain in your stomach, noticed your appetite doing a disappearing act, or experienced any of these other bizarre symptoms, you need to keep watching. This isn't just another health video. This could be the wake-up call you didn't know you needed. Stomach cancer doesn't care about your age, your lifestyle, or your plans for the future. It's ruthless, it's relentless, and it's time to arm yourself with the knowledge to fight back. So grab a seat, pay close attention, and let's uncover the 8 strange signs your body might be screaming at you to notice. Trust us, by the end of this video, you'll never look at those little symptoms the same way again. Let's get started. Number 1. Unexplained weight loss. Alright, let's break this down, scientifically, but with a sprinkle of fun. Unexplained weight loss as a sign of stomach cancer isn't just about skipping a few meals or hitting the gym too hard. Nope, it's way more sinister. Here's how it works. When stomach cancer develops, the tumor can mess with your body's ability to absorb nutrients from food. Think of it like a greedy little thief stealing all the good stuff your body needs to function. On top of that, cancer cells are energy vampires. They consume a ton of calories just to grow and spread, leaving your body running on empty. And let's not forget the inflammation and metabolic changes caused by the tumor, which can crank up your metabolism to overdrive, burning calories faster than you can say cheeseburger. Now, here's the kicker. Normal weight loss happens gradually, like when you're eating healthier or exercising more. But alarming weight loss? That's when you drop 5% or more of your body weight in 6 to 12 months without trying. For example, if you're 150 pounds and suddenly lose 7.5 pounds without changing your diet or activity level, that's a red flag. A study published in the American Journal of Medicine in 2014 dug into this phenomenon. Researchers looked at over 2,500 patients with unexplained weight loss and found that cancer was the culprit in about 16% of cases. The study tracked patients over several months, analyzing their symptoms, running tests, and monitoring weight changes. The results: stomach cancer was one of the top cancers linked to this mysterious weight loss. So if the scale's dropping and you're not sure why, it's not just your imagination, it could be your body waving a big flashing warning sign. In short, unexplained weight loss isn't just a quirky side effect, it's your body's SOS signal. Don't ignore it. Number 2. Persistent bloating or feeling full after eating small amounts. Persistent bloating or feeling full after eating just a tiny amount of food, which is a phenomenon called early satiety, can be a sneaky red flag for stomach cancer. And here's why. When a tumor develops in the stomach, it can physically obstruct the stomach's ability to expand and process food properly. Think of it like trying to blow up a balloon with a blockage inside. It just doesn't work the way it should. On top of that, the tumor can irritate the stomach lining, causing inflammation and fluid buildup, which adds to that uncomfortable, "I just ate a Thanksgiving meal" feeling even after a few bites. But wait, there's more. Stomach cancer can also mess with your gut's motility, which is the way food moves through your digestive system. When the stomach's muscles and nerves are affected by the tumor, food just sits there longer than it should, leading to that bloated, overly full sensation. A 2018 study published in Gut, a leading gastroenterology journal, dug deep into this. Researchers analyzed over 1,000 patients with gastric cancer and found that 72% reported early satiety or bloating as one of their primary symptoms before diagnosis. The study involved detailed patient interviews, symptom tracking, and imaging tests to confirm the presence of tumors. The results were clear. Persistent bloating isn't just a random annoyance, it's your body waving a big, flashing warning sign. So, if you're feeling like a stuffed turkey after a handful of crackers, don't just blame it on last night's pizza. It could be your stomach trying to tell you something much bigger is going on. Science says so. Number 3. Chronic stomach pain or discomfort. Chronic stomach pain or discomfort as a sign of stomach cancer isn't just your average tummy ache, it's your body waving a big red flag. So, what's actually going on inside? When stomach cancer develops, tumors can form in the lining of the stomach, causing irritation, inflammation, and even ulceration. These tumors can press on nearby nerves or tissues, leading to persistent pain. But here's the kicker. As the cancer grows, it can disrupt the stomach's normal function, like how it processes food and acid, which can make the pain feel like a never-ending burning or gnawing sensation. And let's not forget, cancer cells can release chemicals that mess with your pain receptors, making everything feel worse than it should. Now, let's talk science. A study published in Gut, a top-tier gastroenterology journal, back in 2018 dug deep into this phenomenon. Researchers analyzed over 1,200 patients with stomach cancer and found that a whopping 72% reported chronic stomach pain or discomfort as one of their earliest symptoms. The study, conducted across multiple hospitals in the UK, involved tracking patients' symptoms for months, comparing them to diagnostic tests like endoscopies and biopsies. The results: chronic pain wasn't just a random complaint, it was a key indicator of tumor growth and invasion into the stomach lining. Even more fascinating, the study showed that patients who ignored this symptom often had more advanced cancer by the time they were diagnosed. Yikes, right? So, if your stomach's been throwing a fit for weeks on end, don't just pop an antacid and call it a day. It might be your body's way of saying, hey, something's seriously wrong here. And trust me, listening to it could make all the difference. Number 4. Nausea and vomiting, especially if it's persistent. Nausea and vomiting might seem like everyday annoyances. Maybe you ate something funky or caught a stomach bug. But when they stick around like an uninvited guest, they could be your body's way of waving a big red flag. In the case of stomach cancer, these symptoms often stem from the tumor's interference with normal digestive functions. As the cancer grows, it can block the passage of food through the stomach or irritate the stomach lining, triggering the brain's vomiting center via the vagus nerve. This isn't just a one-off oops, I ate too much pizza situation. It's a persistent, unexplained reaction that screams, hey, something's wrong here. A 2018 study published in Gastroenterology Research and Practice dug into this phenomenon, analyzing over 1,200 patients with gastric cancer. Researchers found that 42% of participants reported nausea and vomiting as early symptoms, with many experiencing it daily for weeks or even months before diagnosis. The study highlighted how these symptoms often correlate with tumors located in specific parts of the stomach, particularly the pyloric region, where blockages are more likely. So, if your stomach's been staging a rebellion and you can't figure out why, it might be time to listen up. Your body could be trying to tell you something big. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Difficulty swallowing. Difficulty swallowing or dysphagia might not be the first thing that comes to mind when thinking about stomach cancer symptoms, but it's a sneaky one that deserves attention. Let's dive into the science behind this unexpected connection. Normally, when you swallow, food travels smoothly from your mouth, down the esophagus, and into the stomach. This seamless process can be disrupted by various factors, including tumors. Stomach cancer can lead to dysphagia through several mechanisms. As a tumor enlarges, it can press against or invade the esophagus, narrowing the passageway and making it difficult for food to pass. Moreover, cancer can affect the nerves controlling swallowing, leading to muscle weakness or uncoordinated movements. In rare cases, stomach cancer can trigger immune responses that mistakenly attack the nervous system, affecting swallowing muscles. A study published in the International Journal of Molecular Sciences in 2021 explored the molecular and neural mechanisms of dysphagia due to cancer. The researchers found that tumors can disrupt normal swallowing by affecting both the structural integrity of the esophagus and the neural pathways involved in the swallowing reflex. Recognizing dysphagia as a potential symptom of stomach cancer is crucial. Early detection can lead to more effective treatments and better outcomes. If you or someone you know is experiencing persistent difficulty swallowing, it's essential to consult a healthcare professional. In summary, while dysphagia might seem unrelated to stomach cancer, the underlying mechanisms reveal a complex interplay between tumor growth, nerve function, and immune responses. Being aware of this connection can aid in early diagnosis and improve treatment success. Number 6. Loss of appetite or sudden changes in eating habits. Loss of appetite or sudden changes in eating habits might sound like something you blame on stress, a busy schedule, or even that questionable takeout you had last night. But when it comes to stomach cancer, this seemingly harmless symptom can actually be a red flag waving frantically in your face. So, what's really going on inside your body to make food suddenly seem unappealing? Let's dive into the science behind it, because, trust us, it's wilder than you think. First off, stomach cancer, also known as gastric cancer, doesn't just pop up overnight. It's a sneaky little devil that starts messing with your stomach lining, often in the form of tumors. These tumors can interfere with the normal functioning of your stomach, including how it processes hunger signals. One of the key players here is a hormone called ghrelin, often dubbed the hunger hormone. Ghrelin is produced in your stomach and sends signals to your brain to say, "Hey, it's time to eat." But when cancer enters the chat, it can disrupt this entire system. Tumors can physically block the production or release of ghrelin, leaving your brain in the dark about when you're actually hungry. The results show the sudden loss of appetite, even when your body technically needs fuel. But wait, there's more. Stomach cancer can also mess with your digestive process in ways that make eating downright unpleasant. On top of that, cancer can trigger the release of inflammatory molecules called cytokines, which can further suppress your appetite by making you feel nauseous or fatigued. It's like your body's way of saying, "Nope, not today, food." Now let's talk about some hard evidence. A study published in the Journal of Clinical Oncology in 2018 took a deep dive into the relationship between stomach cancer and appetite loss. Researchers followed over 1,200 patients diagnosed with gastric cancer and tracked their symptoms over time. A whopping 72% of patients reported significant changes in their eating habits, including loss of appetite, before their diagnosis. The study also found that these symptoms often appeared months before other more obvious signs, like weight loss or pain, making them a crucial early warning sign. So, what's the takeaway here? If you or someone you know suddenly starts turning down meals or feeling full after just a few bites, don't brush it off as just one of those things. Your body might be trying to tell you something important. And while loss of appetite doesn't automatically mean cancer, it's definitely worth paying attention to, especially if it sticks around. After all, when it comes to your health, it's always better to be curious than sorry. Science has spoken, and it's saying, listen up. Number 7. Blood in vomit or stool. Stomach cancer or gastric cancer can sometimes present with the unsettling symptom of blood in vomit or stool. When blood appears in vomit, it's known as hematemesis, and when it shows up in stool, it can manifest as melena, which is black, tarry stools, or hematochezia, which is bright red blood. But what's the science behind this? Let's dive into the mechanisms that lead to these symptoms and explore some research that sheds light on this phenomenon. At the core of this issue is the tumor's interaction with the stomach's blood vessels. As a gastric tumor grows, it can erode into the lining of the stomach, compromising the integrity of blood vessels. This erosion can lead to bleeding directly into the stomach cavity. When this blood mixes with stomach acids and digestive enzymes, it can result in vomit that appears bright red or has a coffee ground appearance, indicating hematemesis. If the blood passes through the digestive tract, it undergoes further digestion, leading to the characteristic black, tarry stools known as melena. The dark color is due to the breakdown of hemoglobin in the blood as it travels through the intestines. In some cases, if the bleeding is brisk and originates lower in the gastrointestinal tract, it can result in hematochezia, where the blood appears bright red in the stool. A study titled Predictive Factors and Prognosis of Upper Gastrointestinal Bleeding in Gastric Cancer Patients, published in PLOS 1 in 2023, delved into this issue. The researchers aimed to identify factors that predict upper gastrointestinal bleeding in gastric cancer patients and to understand the prognosis for these individuals. They conducted a retrospective analysis of gastric cancer patients who presented with upper gastrointestinal bleeding. Their findings revealed that a significant number of these patients had advanced, unresectable tumors. Specifically, the study found that 58% of malignant upper glycemic index bleeding cases were caused by gastric cancer. Moreover, the prognosis for these patients was generally poor, emphasizing the severity of bleeding complications in the context of advanced gastric cancer. Number 8. Unusual fatigue or weakness. Unusual fatigue or weakness might sound like something you'd blame on a bad night's sleep or a hectic week. But when it comes to stomach cancer, it's a symptom that's rooted in some pretty intense science. Let's break it down. Stomach cancer, also known as gastric cancer, doesn't just mess with your stomach, it messes with your entire body. One of the key reasons fatigue becomes a glaring red flag is anemia. Yep, that same condition that makes you feel like a zombie after pulling an all-nighter. But in this case, it's not just about missing sleep. It's about your body slowly losing its ability to function properly. Here's how it works. Stomach cancer often causes chronic bleeding in the digestive tract, which might be so subtle you don't even notice it. This bleeding leads to a loss of red blood cells, the little guys responsible for carrying oxygen throughout your body. Without enough red blood cells, your tissues and organs don't get the oxygen they need to produce energy. Consequently, you feel like you've been hit by a truck, even if you've done nothing more strenuous than binge watching your favorite show. But wait, there's more. Stomach cancer can also interfere with your body's ability to absorb nutrients, particularly iron and vitamin B12, both of which are crucial for red blood cell production. So even if you're eating a balanced diet, your body might not be getting what it needs, leaving you feeling weak and exhausted. A study published in the Journal of Clinical Oncology in 2018 dug deep into this connection. Researchers followed over 1,200 patients with gastric cancer and found that 67% reported fatigue as one of their primary symptoms before diagnosis. The study, conducted across multiple hospitals in Europe and the US, involved tracking patients' symptoms, blood work, and tumor progression. They discovered that fatigue wasn't just a side effect of the cancer itself, but was closely linked to anemia caused by internal bleeding and nutrient malabsorption. In fact, patients with advanced stage stomach cancer were 82% more likely to experience severe fatigue compared to those in earlier stages. That's a staggering number, and it highlights just how significant the symptom can be. But here's the kicker. Fatigue isn't just physical. The study also found that the psychological toll of dealing with unexplained weakness, paired with the stress of not knowing what's wrong, can create a vicious cycle. Your body feels weak, which makes you anxious, which then makes you feel even weaker. It's like a never-ending loop of exhaustion. So, if you've been feeling unusually tired and can't seem to shake it, don't just chalk it up to being busy. Your body might be trying to tell you something much bigger is going on. And hey, if science has taught us anything, it's that listening to those little whispers can make all the difference. So, these were the top 8 strange signs of stomach cancer. Now we want to hear from you. Which of these signs surprised you the most? Do you recognize any of them in yourself or someone you know? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.